Nearly 304 million people live in the United States of America. How many of these people should have access to health care? 47 million people do not have health insurance. 30% of young adults are uninsured. 1 in 10 U.S. citizens between the ages of 18 and 64 cannot afford necessary prescription drugs. 10% of U.S. citizens must delay receiving needed care due to cost. 1 in 10 U.S. citizens 45 to 64 years old have no insurance. 50% of them will be diagnosed with high blood pressure, serious heart conditions, diabetes. Every 30 seconds, someone in the U.S. files for bankruptcy due to medical debt. The quality of the U.S. healthcare system is ranked 37th in the world. Every year, 7 out of 1,000 babies die in the U.S. at birth. 101,000 people die each year because of lack of necessary medical procedures in the U.S. The United States of America is the only industrialized country in the world that does not provide universal insurance to its residents. We know this is a problem, but what is the solution? Representative John Conyers suggests a very simple idea. Expand and improve Medicare for everybody. A single-payer national health care plan. Single-payer is universal and guaranteed, comprehensive, filled with free choice, cost-effective, good for the U.S. economy, and brings back pride to our country. Everyone is automatically included in this health care plan from birth to death, regardless of unemployment, health status, or ability to pay. A single-payer plan will cover all medically necessary primary and specialist care, hospital visits, prescriptions, home care, long-term care, mental health, dental, vision, hearing, physical therapy, chiropractic, preventative care, and more. No out-of-pocket expenses, no copays, no deductibles, no coinsurance. People in the United States love choice, and with the single-payer system, you'll have more choice because you can go to any doctor in any hospital anywhere in the U.S. without worrying that you will be out of network or denied care. The single-payer plan is very cost-effective because healthcare costs are spread out and everyone contributes to one healthcare fund. This is already how we pay for other necessary services, such as the fire department, public education, and the police. Currently, 60% of healthcare is already paid through taxes from the people of the United States. That 40% of the pie just removed represents the money people in the U.S. pay to health insurance companies. We pay twice as much as the average industrialized country because of the insurance companies' bloated administration, marketing costs, and CEO salaries. Under Bill H.R. 676, the 60% already in place from the government stays there, and we add a small 3.3% employees' payroll tax, which is nothing compared to the amount we pay for health insurance under the current system. In addition, employers will pay a 4.75% on employee pay. 5% health tax is paid by the top 5% of income earners, and a 10% tax on the top 1%, something any millionaire can afford. A 1/10 of 1% tax on stock and bond transfer, and the repeal of the tax cut for the highest 1% of income earners. Again, something millionaires should be able to cope with. Finally, because a single-payer system replaces the profiteers of the health insurance companies with one source of funding to hospitals and doctors, it will reduce administration and marketing costs, save money by bulk purchasing of prescription drugs, and the elimination of huge CEO salaries to result in savings of $350 billion. Americans will pay less and get more. We will have a healthier, more productive workforce. No more holding on to a dead-end job just for the health insurance. And companies like Starbucks will no longer pay more for health insurance than for coffee. Access to comprehensive quality health care is part of life, liberty, and the pursuit of happiness. It is not a privilege only for the wealthy. This is the land of equal opportunity, after all, isn't it? It's that easy. Everybody in, nobody out. Let's bring the greatest gift of health to everyone in the United States: peace of mind. Single-payer health care, Bill H.R. 676. Together, we can. Join the movement for single-payer health care. www.healthcare-now.org.